Thank you so much for coming, and welcome to the Face of Transnational Corruption, cracking down on illicit trade and falsified medicines. We hope to have what is a multi-sectoral debate today on the technical and technological challenges related to trafficker impunity in the health sector. My name is Rebecca Turner, and I'm a senior technical advisor working with USAID's Bureau for Global Health and the Democracy, Rights, and Governance Bureau's Anticorruption Center, and I'll be your moderator today. According to the World Health Organization, roughly 10% of medical products circulating in low and middle income countries are substandard or falsified. In the Sahel region alone, studies point to an even higher 19 to 50% of trafficked medical products being substandard or falsified. Transnational corruption crosses borders, involves global networks, and employs sophisticated schemes by political and economic elites to really siphon off the wealth of a country from its rightful owners, the people. Make no mistake, the transnational illicit trade of substandard falsified medical products is not without a victim. Nearly 500,000 people are estimated to be killed by counterfeit medicines in sub-Saharan Africa every year. I'm really pleased to be here today, joined by a wonderful panel of subject matter experts from multiple sectors, including law enforcement, technology service providers, and the private sector, brought together to identify the challenges as well as tangible approaches to curtailing this illicit trade. So allow me to introduce our panel, starting at the far end. Barbara Baduino is the head of corporate ethics, risk, and compliance at Novartis, where her focus is on the implementation of integrated assurance at the enterprise level through integrating governance, risk management, compliance, and internal controls. She began as a chemist in Italy with a focus on assurance and governance, and her responsibilities now cover integrated risk and compliance management, anti-bribery, conflict of interest, human rights, and labor rights. Next, we have Tom Woods. Tom is the Washington, D.C.-based managing partner of the Global Health Assurance Partnership, a prime contractor for USAID, focused on health commodity supply chain assurance. Tom's also the president of Woods International LLC, a private consulting firm focused really on private sector advisory services and public-private partnerships for global development. He also serves as the chairman of the Global Steering Committee for Quality Assurance of Medicines, which is a coalition made up of the largest health financing and development agencies, together with leading pharmaceutical manufacturers. He also served as the U.S. Deputy Assistant Secretary of State for Africa and led U.S. engagement with 25 countries in West and Southern Africa. Thanks for being here. Next, we have Mariko Kitahama, who is an assistant manager in the Social Impact Business Group of the Global Relations Department at NEC Corporation, a technology service provider, where she collaborates with the United Nations and other international organizations and governments to develop solutions for social issues. After joining NEC, she was responsible for the African market at the Europe, Middle East, and African Department of Headquarters, and she was assigned to business development for Africa Nairobi office, where she engaged in projects focused on creating safer societies. Thank you, Mariko. And last but not least, we have Chi-Wang Lam. He joined Interpol as the coordinator of public health and pharmaceutical crime unit at the beginning of 2021. He leads the unit to support Interpol's 196 member countries in the fight against pharmaceutical crime by promoting intelligence sharing and organizing operational activities, such as the global Operation Pangea, which we'll hear about soon. As a customs officer from Hong Kong, seconded to the largest criminal police organization in the world, he fully appreciates the need for collaboration among different stakeholders in tracking down criminals selling illicit pharmaceutical products. Thank you so much, all of you, for being here. So now let's kick it off. I'm going to pass it to you, Barbara, to set the scene a little bit on the current landscape for substandard falsified medicines, what Novartis is doing to strengthen the capacity to be able to detect them, the linkage that we see to corruption and the transnational illicit trade, and then maybe if you could also speak a little bit about public and private interfaces for collaboration in the frame of investigations. Thanks, and over to you.
Thanks a lot. Thank you. It's a lot of topics, but I'm really glad to be able to speak about them. And I also trust that my colleagues will, of course, add a lot of colors, because that's really a complicated topic that we all together really need to address. But linking back to the corruption element, because I think that's the topic, right, that really want to explore. Corruption is really undermining what is the enforcement and regulatory framework that is there to ensure safety and efficacy of pharmaceutical product. And this is really the core of really the basics of pharmaceutical industry, ensuring safety and efficacy of product, because products really are being delivered to patients in need, patients that have already compromised health conditions, that maybe have immunodepressed systems, that potentially are aging. And if you can imagine the effect, the devastating effect of a falsified medicine, something that either doesn't have active ingredient or even low quality, poor quality, no quality ingredients into that, you can really imagine, and you just share some numbers, it's really devastating, the effect that this can have on patients. And that's what we really should really focus on, ensuring that no eye is really turned blind when across the whole supply chain and across the whole chain of value of pharmaceuticals. So said that, I think the other element that I also would like to highlight is that when we talk about falsified medicine, it's not just and only about products that are produced in kind of copied in whatever place in the world using low quality ingredients to mimic the original product. We're also talking about diversion of original product into countries where they're not supposed to be. So molecules and original product are injected into a broader healthcare system that is not ready to get them, because patients, healthcares are not trained on the use. They're not aware of the effect that the molecule can have, the mode of action, interaction with other drug products and other side effects that this may create. So it's really complicated, and it's also very much dangerous when not used properly. So that's another big element. The other element of overall falsified medicine framework is also kind of the manipulation of the expiry date. We see very much that expired products are kind of falsified. The expiry date is falsified, and then original products are used for longer than what they are supposed to be used, which of course doesn't really necessarily ensure the quality and the efficacy of the product after the expiry date. So this is like the three major elements of falsified medicine. It's really a complex environment, and it's also very much complex, the overall supply chain and kind of value chain of products. If you think that products are manufactured, then are shipped through carrier, then they get to global healthcare provider, they're really going through wholesaler, they then distributed locally, they pass on to the hands of hospitals, nurse, and all in between you always have warehouses, storage, you have as well customs check. So there are lots of hands that in a way touch the supply chain of products, and these are all potential kind of failure in the overall process. So it's a complicated topic. It has a lot of diverse aspects that of course we all need to address, and no one can do that in isolation. So as a representative for a private sector, for a pharmaceutical industry, we focused a lot on partnering with authorities and law enforcement to ensure that really we can do our part. One element of that is the overall proactive screening, proactive monitoring of the web, proactive monitoring of certain markets. It's a risk-based approach. We don't have unlimited resources to do that, and that's something we also need to be conscious about. So we focus on certain risk areas, and that's where we try really to become proactive in identifying where products potentially could be sold on the market and not in a legal way. And that's where we really partner, and we have Interpol here today to also tell us what are the experiences of this partnership between the public and also the private sector on the overall investigation and the overall monitoring. That's one of the proactive action that we take. Of course, we also go into the level of details of reactive when products are detected to be falsified, and then we need to confirm that they're actually falsified product. That's what we do with, of course, support of technology. And this is a pivotal time for technology. We heard a lot about artificial intelligence that could help us in the screening, for example. We heard a lot about new technology also in the pharmaceutical industry. We have a lot of means that we can use to detect and really bring on the field directly this technology to confirm the origin of a product. You can think about really small devices or iPhones that are able really to do this kind of checks. But that's not enough. Technology is an enabler, but I mean, it's a broken record probably. You heard it already many times. It's really about collaborating across boundaries, collaborating across different pharmaceutical sectors. It's really collaborating with authorities. It's really a collective action and really a joint venture that we need really to drive, because it's such a complex topic, such an important topic, and the effects of falsified medicine are so big and so devastating on patients that really we cannot afford to work alone in silos. So I think that's overall my kind of key message for this introduction part is really let's think as a community on how to address the topic, because no one can really be able to fight and win this fight alone. It's really a collaborative effort that we need to ensure as we move forward.
Thank you so much, Barbara. It's really helpful to have the perspective and to understand the role of a private sector manufacturer in the fight against this illicit trade that we know results in loss of life. So thank you. I'd like to turn now to you, Chi Wang. We want to hear a little bit from you on how you receive information regarding the loss of medicine in legal supply chains as well as illicit supply chains, and maybe you could talk a little bit about Operation Pangea, and in your opinion, how Interpol could do better against this, in this fight against illicit trade of substandard and falsified medicines.
Thank you, Becky. So first of all, I have to say thank you to having me in this panel discussion. And please allow me to introduce myself again because I know our audience group is getting bigger. So my name is Chi Wan Lam. I'm a seconded officer from Hong Kong Customs joining Interpol, and I'm based in Lyon, France. My role is a coordinator, something like a unit manager, to lead a team to support our member countries in fighting pharmaceutical crime. And I have to be honest with you because my main work is on public health and pharmaceutical crime and have need to experience in anti-corruption. But I think from my perspective, I can contribute to provide more information to you or some case information that relating to the illicit sale of pharmaceutical products. And I will promise you that my work is not as exciting as those you find on Netflix or on movie. So I hope my story won't bore you. So before I provide some cases, which is real case with you, I would like to share with you my views about the challenges in fighting pharmaceutical crime. So, it's a law enforcement. We have a very clear definition of our work. So we don't work, for example, if I work on pharmaceutical crime, if there is a case relating to corruption, I will pass the case to the anti-corruption unit. I think it's understandable because, we are colleagues, we don't want to step on others' toes, we don't want to step in other territory, and administratively, we have to act based on the power we have. We cannot act beyond that. It's not, we cannot do ultra vires, which is beyond the authority we have. So, but our enemies I mean our opponents, criminals, they don't have this kind of limitations. You know, they don't need MOU when, for example, for the pharmaceutical crime criminals, they don't need to sign an MOU to work with corruption expert. They can go straight ahead, right? They don't need to do something like a declaration to declare they're going to infiltrate the supply chain of medicine. So you can imagine that we have a big gap between criminals in pharma crime and also the law enforcement. But what we are going to do from Interpol's perspective, we would like to shorten the gap. We would like to close the gap. But how we can do it? This is the main difficulties, right? We know we have to fight the pharmaceutical crime. We know we have this commitment to protect the public health. But in reality, how we can put it in action, this is another difficult issue. And from my perspective, why is it so difficult? Because we don't have a superhero. I'm serious to you. Why I say this? Because, for example, for a drug offense, you have superhero like DEA in the US, like an investigator. In corruption crime, you have a superhero like those whistleblower, right? But in pharmaceutical crime, there is no single superhero. For example, for the law enforcement, for the police, when you talk about them, talk to them where there's a pharmaceutical crime, maybe the priority for them is not that high. They will say, okay, we have other commitments, we have other priority, we have drugs, we have firearms, smuggling, they have other issues. And they think, perhaps some of them, they will think that this is the issue of regulators. And then, you know, when you're talking about a transnational crime, you also have to engage with customs. But for customs, you know, I'm a custom officer from Hong Kong. We know that for customs, they focus on the counterfeit. So they will work with the right owners, which is the trademark owners, to see if the imported cargoes or export cargoes is it a counterfeit products, counterfeit pharmaceutical products. But this term counterfeit is not the terms used by the regulators, because for the regulators they use substandard and falsified. And you know, when you go to the health regulators, to be honest, sometimes they don't work with the police. I think it is understandable. For example, if you take a medicine and it doesn't work, the first thing in your mind is not that the criminal element behind this medicine. It is, for example, you will think you are unlucky, you can't get the right pills, so you will go back to the you will go back to the medical practitioner and tell them the situation. And the doctor may think that, okay, this medicine doesn't work on your case, but it doesn't mean that it is counterfeit, or he doesn't doubt whether the source or whether it is substandard or falsified. And at the end, nothing will be reported to the police. And if you don't report to the police, if there is no victim for the police, very rare for them, they will take proactive action to do the investigation. So that's why I think even if we have police, we have customs, we have health regulators, if they don't work together, it is difficult to fight pharmaceutical crime. And you know, just 2 days ago, WHO, they published a medical alert on a weight loss pens. And it is substandard and falsified from their terminology. And what is their advice to the health practitioner, and what is the advice they give to the National Health Authority? In the alert, they said that, okay, if for the health professionals, if you have come across these kinds of suspected substandard and falsified products, please report the case to the National Health Authority. And then the advice to the health authority is, once you receive this information, please report to the WHO. But there's nothing saying that you have to report this substandard and falsified product to the police. You see, every time when I talk to our counterparts or in regulatory bodies, in custom, in police, I always mention that, hey, don't think about your job first. Think about you are the member, just a normal member of the public. If you know that there is a counterfeit or substandard and falsified medicine, whatever you call it, it's illicit, found in the supply chain in your country. What, as a member of the public, what do you expect your government to do? Just find out the source, or you want to find out the criminals and to stop their business? I know everyone have the answer, right? So I think that's why we need to work together to fight pharmaceutical crime is very important. And we are not alone. I mean, we have a private sector, like pharmaceutical companies. And I believe they have the most or the strongest sense or commitment to fight pharmaceutical crime, because they have to be accountable to their investors to protect their products, right? So, and to be honest, I remember when I first conducted pharmaceutical crime investigation in Hong Kong, which is 15 or more years ago. And then there was a case relating to counterfeit erectile dysfunction products. And then we spoke to the rights owners, and he invited me to his office, which is an investigative office on the counterfeit products of their products. And I looked at their database. The database they have is global. Because you can imagine I'm from a local authority. What information I have is the local information. I have the case from the local only. But for the rights owners, they have office or investigator in different parts of the world. They can get the information, consolidate it. So sometimes pharmaceutical company, they have more information than the national law enforcement. But to be honest, for the private sector, even they have the information, if they cannot turn it into a tangible result, it's just letters or numbers in the database. So they need the support from, or they need the law enforcement to carry out their work, to find out the counterfeit or the illicit products and to arrest the bad guys. So that's why we work very closely with different pharmaceutical companies. We have regular meetings with them to get the information and to understand the trends and also the threat that we have in this pharmaceutical crime landscape. And then I would like to go to the Operation Pangaea. Why it is important? Because even if we promote inter-agency collaboration, if we cannot set up some operational activities, local enforcement, law enforcement, maybe they don't take action. Mm-hmm. So that's why we have this global operation. This is one of our flagship operations. It started in 2008. When it started in the first edition, at that time, it was just a few countries participating in it. But after 16, 17 years, the countries participating in it, it grew up to more than 90. So more than 90 member countries of Interpol, they joined this global operation. And why we set up this global operation? Because we know that for the law enforcement, when you talk to the police, talk to the customs, talk to the health regulators, they will say they are busy. Right? So for us, when we conduct the operation, we set up a week of action, just 1 week in the year, 52. I know you focus a lot of things, but just spend 1 week focusing on pharmaceutical crime, sharing the information. So we have during this week of action, we set up a command center in our headquarters, and for the participating member countries, once they have a case, they have a results, they could share with us, and we take a look and see if it is connecting to other countries. And if yes, then we will reach out to the reporting country, get their consent, pass the information to the relevant countries, and hope them to do the follow-up. Because we all know that for the transnational crime, you have to work with different countries because of the jurisdiction issue. So if you don't work like this, I think for the criminals, they are very happy because it generates huge products. How big it is, I can share with you a case that I just learned it from my colleagues from Hong Kong.
It happened while he's been at IACC.
Yeah. Yeah, that's true. And so I just learned that they just detect 2 cases on the same day. It originally from a postal article that they intercept when it goes out from Hong Kong to Italy. It was just last in late May, just 2 or 3 weeks before. And then in the postal article, custom officer, they found 22 tablets of illicit medicine, just 22. But they conducted a follow-up investigation. They identified who posted these postal articles. And after some surveillance or checking, they identified 2 couriers. They post similar postal articles in 2 different post offices in Hong Kong. And of course, my colleagues in Hong Kong, they also conduct follow-up action and to do the surveillance on where they get the medicine. And as a result, they identified 2 warehouses in Hong Kong. So just last week, they took enforcement action. They took an ambush on the 2 couriers when they post the articles. So after they intercept the 2 couriers from their baggage, they found in total, 16,000 of tablets found in the baggage of the 2 couriers. That's they're ready to ship it in the post airmail center in Hong Kong. So we are talking about 16,000 medicine in a day. So if you multiply 16,000 to 365 days so just 1 year, the volume of the medicine they post, it will be around 6 million. So if I assume, very naively to assume, for the criminals, they just earn €1 per tablet, which means that in 1 year, they can earn €6 million, and it's tax-free. But we are just talking about 2 couriers. And of course, after the colleagues they intercept these 2 couriers, they took them back to their warehouse. And then, you know what? Millions of illicit medicine were found in this warehouse. Mm-hmm. And they are still counting on this volume, I mean the medicine found in these 2 warehouses. And what is more important is, for Interpol, we like to find out the bad guys, the ringleaders. And obviously, these 4 people, the 2 people manned the warehouse and also the 2 couriers, they are not the ringleaders. Because from the surveillance, they are just doing their own part of job. They don't touch on the source, how they import the goods, they don't touch on it. How the money goes, they don't touch on it. So this is the follow-up investigation that the law enforcement have to do. Sorry. So, but another follow-up investigation they have to do is to find out who is the recipient in other countries. Because on the day that they did the ambush on the 2 couriers, seized 16,000 of tablets, on the envelope or in the packaging of the postal articles, there are recipients' information. For the postal articles, all information can be fake, but 2 information must be correct. First of all, is the postage. If you don't pay enough postage, post officer won't deliver the goods to your destination, right? And the second information is the recipient information. The shipper information can be fake, but the recipient information must be correct. Otherwise, the recipient cannot get the goods, right? So we have the information of the perhaps consumer, which may be the end user of the 16,000 medicines that they ship on that day. But it could also be the distributor in these 16 countries. So we have to pass this information
How
to
many countries?
60.
60.
So sorry for my accent.
Yeah, no. I mean, it speaks to the transnational pervasiveness of
So, it's a lot. Yeah. We have to pass this information to these 60 countries to do the follow-up investigation. So I hope that this case is just one single case, but we all know that it just maybe just tips of iceberg. So I can also share with you some cases that since just since last year, in the past 18 months, that's relating to the medicine found in the supply chain. So, for the Ozempic pens that I shared with you, that WHO, they published a medical alert 2 days ago. It mentioned that this counterfeit or substance and falsified medicine, the Ozempic pens, they were found in the regulated supply chain in American and European region. And if you think it's just a regional problem, so listen. So for this, let me take a look on my looks. For the second case, the source information is from a pharmaceutical company. They told us that they want to seek our support to work with a country in West Africa, because in the production line, there are more than 300,000 of pills were stolen. And this 300,000 of pills, when they were stolen, at that time, it didn't have any packaging in it, which means it's just like a tablet. And this makes the investigation very difficult, because you don't know or you can't trace this medicine. And for the police they don't take a good efforts to track down the matter or who stole this medicine. And so this is the case relating to the stolen medicine. And then we also have a case in Central Africa. They also seize counterfeit medicine in the local pharmacies. And what scared me is they also arrest 2 pharmacists in the country who supply or to stole this medicine from the supply chain. It's in Central Africa. And then we also have a case during the Operation Pangea last year. In the supply chain is very long, from production to the retail point and also to the consumer. But it also includes some expired products. So we had a case last year during the Pangea in South Africa, in the land boundary point between 2 countries in that region. They seized more than 10,000 medicine which are expired, but it's original but expired, and this product should be supplied to the country in Europe, in one of the biggest country in European Union. So you can imagine it is expired in Europe, but it's shipped to the inland country in South America. And then I also have another case which is also during the Operation Pangea. As I mentioned, we would like to promote the follow-up action to fight against the criminals behind the illicit sale of medicine. So during the last year Operation Pangea, in one of the ASEAN country, he reported to us that they found a distributor in another ASEAN country in that region who distribute the illicit medicine. And then we got the information, we do the analytical work and to support or to make the information better, and then we pass the information to the distributing country. And the country, they got the information and they're happy and they took enforcement action. And in that case, they seized a large number of medicine. And the problem is where the medicine come from. Is from the hospital. There is a medical practitioner in the hospital. They got the medicine out, and then they sell it on the internet and distribute it to the ASEAN countries, not in the same country, but to other countries with the help of the e-commerce platform.
And I think these cases really help paint the picture of the complexity of the issue and then how to even detect the linkages to corrupt officials that are facilitating the movement of this illicit trade. So whenever you get information like this, like the information you've shared, can you explain a little bit about how you work to support member countries in advancing the investigation, especially when there's cross-jurisdictional implication?
Yeah, thank you for this question. And I would love to have a team of specialized agents, armored vehicles. I can go there just like what we see from Netflix. But in reality, I'm sorry, we don't have this kind of resources, and we are pretty thin on the ground. And for Interpol, we are not an enforcement or investigative body. So our role is to support the police to work together. So we cannot go to the country, we cannot just jump out from nowhere and then arrest a guy which is on our wish list, that's commonly known as red notice. But what we can do is to, when we have the information, we have to work with our member country. So for example, if we got the information from private sector, this information that is not from the law enforcement, if not from our contact point, I mean not from the contact point of Interpol in each country, we have to take this information from private sector. We will reach out to the member country. In each of our 196 member country, we have a Interpol National Central Bureau, in short NCB. So this NCB, they are manned by the police, they are the Interpol's office, and although they are not directly hired by Interpol, it's the local police to man this office. And what the role of this NCB is to communicate with each other NCBs and also the headquarters in Interpol. For example, in the US, you have NCB Washington, and for example, in Japan, you have NCB Tokyo. So for example, if we have information from private sector and saying that, okay, this case is in Japan, we have to, although we have the information, but we cannot use it because we need the local police to validate it. So we will reach out to NCB Japan through a secured communication system, which we call it I-24/7. This is a communication system that connects all the NCBs in the world, and then we will ask, okay, NCB Tokyo, we have this information, can you validate it? And then to see what, if they can validate it, we can use the information and then to see, okay, how, first of all, to put in our database, to do the matching, to see if it is relating to other serious crime or other cases before. And then after that, we will see, okay, if with the consent of NCB Tokyo, we could reach out to the relevant countries and ask them to have a joint investigation. So we will invite, if we have enough funding, of course, we can invite them to come to Interpol to have a face-to-face discussion on this case. Because you could imagine in the National Central Bureau, NCB, most of them, they are the liaison officer. They are not the boots on the ground. They don't do investigation by themselves. Maybe when they have the information, they will have to pass the information to their colleagues which working on this investigation area. So that it's very crucial to find out the investigator, put them or to get them around the table and to discuss the case.
Yeah, and I think one of the themes coming out of IACC that we've heard a lot is that investigative bodies are completely overwhelmed. The backlog is enormous. They're completely overwhelmed. And so one of the hypotheses that we wanted to test, like in a live debate today on this panel, is we always talk about the role of technology, and we tend to look at it in a vacuum, and we'd really like to ground truth it with law enforcement to say, if we were to apply a leapfrog technology to be used for detection of illicitly traded, substandard, and falsified pharmaceuticals, could that mean a different jumping off point for law enforcement when conducting their investigation? So with that, I wanted to turn to you, Mariko, and given the complexities that were just shared, and as a blockchain and technology service provider, noting these primary challenges of detection that are crucial to design a blockchain system that enhances investigation speed and can accurately identify correct data sources and responsible stakeholders, could you share a little bit about an application that was already developed in the agricultural sector and explain maybe how that use case could be applicable to the transnational detection of the illicit trade of pharmaceuticals?
Sure, thanks, Becky, sorry. Well, let me start with introduction myself to the audience. So my name is Mariko from NEC Corporation, and NEC Corporation is an ICT company based in Japan, having the business globally. So as Becky kindly introduced, well, as NEC, we have a technology provider, specific, and also have an experience to deploy the blockchain technology in agriculture sector. So I believe that what we did in agriculture sector and what we discussed here for the illegal transaction in health sector have some common point. So the first point would be like the complexity of the supply chain itself. So NEC has a case to deploy the blockchain solution to the Indian spice market, co-working with UNDP and also Ministry of Agriculture in India. So what we saw as a problem for the agriculture sector would be the complexity of the supply chain. I mean, starting from the farmers who produce the tea, and they will sell it to the middlemen at the Indian internal market, then middleman to middleman, and middleman to middleman, then finally middleman to sell the product to the export company. And of course, during that process, the farmers need to get some certificate to assure the quality of the product. Then, so there are so many stakeholders in the agriculture sector. So, and the challenges we had for that situation is the farmers cannot receive the fair price because they don't know what is the final price for the exportation. And for the government of India, they also had some challenges, that quality assurance, because the middleman gathers all the product from so many farmers, so they cannot guarantee the quality itself. So we see that situation and discussed with UNDP and the government. So we decided to introduce the blockchain technology to visualize the supply chain. So what we did is to ask the farmers to put the data when they farm it and when they provide the fertilizers and also pesticides, so that the farmers can easily apply for the certificate that this product has a less pesticides, for example, so that they can improve the quality and assure the quality. Then they can sell it to the middleman, and also middleman also put the information when they sell it and what the price they put, like that, so that we can see and visualize all the transaction happened through starting from the farmers ending to the export companies. So that's what we did. And with that blockchain technology, we succeeded in 20% up of the income for the farmers. So, what I want to deliver here is like complexity of the supply chain for the pharmaceutical sectors or health sectors would be similar to that case, because pharmaceutical sectors, if we want to sell the one medicine, like the pharmaceutical companies, like will produce the medicine, then send it to the quality check to the authority. Then that medicine could be sent to the warehouse to keep for a moment and do some custom clearance, export, and then import, and distribution company will receive it and then distribute it to the main hospitals or local hospital, like that. So there are so many stakeholders there. So we believe that what we did in India for agriculture sector could be applied to this health sector. To the transaction in health sector.
Thank you so much, Mariko. I want to turn to you, Tom, someone passionate about medicine quality, done a lot of work on traceability, also looking at detection of corruption and public health supply chains. So we often hear about the use of technology in the battle against the falsified and diverted health commodities. Can you comment a little bit about what you think on the role of technology and how it should play into our collective action efforts to counter corruption in health systems generally, and also health commodity supply chains in particular?
Sure, thank you. First, let me commend you all for even being here. You get like bonus points. I've never been on a panel that came after the final plenary session, so this is a new experience. Good job. Look, pharmaceutical crime. Let's call them illicit medicines. It's not like other forms of corruption. At that last plenary session, they equated corruption to a violation of human rights. Let's take it a little bit further. This is corruption, a violation of human rights, and in some cases, murder. So when you have illicit medicines, we're talking about, first of all, harm to a patient. They don't get the medicine that they were looking for. So their disease goes untreated. They may die, they may not die. They could get a toxin in a fake medicine, so that has killed people in various cases. Or maybe they just get a sugar pill or some water and they just don't get better. Another incident is stolen medicines. I mean, we don't talk, it was slightly hinted at with diversion, which is, in the case of, say, lower income countries, it's a polite way of saying stolen medicines. So often you have publicly provided medicines that get diverted into the private sector. And that deprives the poorest of the poor from healing medicine. So you have that layer of crime. So you have potential murder, you have criminality, which destabilizes a country, right? Because you have these criminal networks that are all part of this. They're swimming in the same stream with other forms of criminality. And then add to that, with the stolen medicine issue, you have a bilateral problem with the relationships between countries, because many of these stolen medicines are donated. They're donated by the big aid agencies. Okay, so you have theft of donated aid medicines. That's corruption. That's the nexus to this very conference. That's the corruption. And then, so illicit medicines, big issue. Now, you asked me about the technology. My view of technology in this space has evolved over time. I was thinking back to, I've been at this some time. I took Dan Rather, if any of you know US News, I took Dan Rather to Nigeria like 11 years ago. And we were pulling medicines off the shelf in Lagos and zapping them with the latest technology, the handheld Raman spectrometer. You know, we've all heard of the TrueScan, and it works. It still works. It's still the cutting edge. So it's been available for all these years. It's still not being widely used. We've talked about traceability. I went to a traceability event, a GS1, global standards. You would think, I often ask people, what was the first product that got a barcode on it? And when was it? Raise your hand if you know. Okay, you don't know, you're asleep. 1973, a pack of juicy fruit gum. Okay, and yet life-saving medicine, you can't put a barcode on it? We put a barcode on everything. Okay, so this, it gets at a broader question. I say my concern or theory around use of technology has evolved. We've had the technology. We have the technology. You could put it in place tomorrow. So it really gets to this idea that technology is tools. You need a toolkit, and you need layers of technology. So yes, traceability is great. Tracing a medicine from the manufacturer to the patient and scanning it various points along the line, maybe blockchain further down the line. That's an evolution of that technology. We need forensic technologies that look at the chemistry of the product. That's all great. Layer it in there. But at the end of the day, technology doesn't catch bad guys. People catch bad guys. So it gets back to some of these very basic issues of Do we need more technology? Do we need the right technology? It needs to be scalable, it needs to be suited to the environment, but technology isn't our limitation. At the end of the day, it is corruption, and it's a human solution. And bottom line is, if we look, we're going to find this problem in many countries. Technology is one potential avenue to helping to solve it.
Thank you so much, Tom. So I'm coming back to you, given what he just said. Can you share some of the considerations for the applicability of data that can come out of innovative technology, like what Mariko just shared, but in the context of transnational corruption? And so thinking through chain of custody and the forensics and, is this something that could leapfrog your investigation? I know you've also, we've discussed like the risk of criminals actually exploiting the technology to further their own illicit business. So can you also caution and maybe ground truth us a little bit on that?
Yeah, I will never underestimate the creativity of the criminals, because it's their business, right? So yes, we have this technology in place, we have blockchain, even we have AI. But first of all, we have, like Interpol, we have 196 member countries. And you could understand that every country, maybe they have different capability in adapting different technologies. For example, we have, during the COVID time, when we have virtual calls every day, we want to make calls with African countries. Some of them, they cannot answer 2 calls per week. Because for them, they said that, yes, we have computer, we have mobile phone, we have the camera, but we don't have the mobile data plan. Finish, just 1 call a week. And then, just like sometimes when we are talking about deployment to fight a crime, you can donate a car to them, but they don't have gas. You see, so you can understand this is also the matter of resources. And the second thing is about whether they have the capability to use the technology to do the investigation. You're right that you can with the blockchain technology, you can trace the different points, different time, or different milestone of how the goods go from the manufacturer to the end user. But it will involve a lot of information. Do they have the capability to analyze it, to find out the investigation? Last week, I was in another event working with the regulators. And then we had a exercise on a crime scene that there was a warehouse with thousands of illicit medicine. And at the same time, there's an office with a computer. And on the computer, they found in my favorite, there was a link of how they can get the illicit medicine. But for the regulators, they do not know how to extract the evidence, the digital evidence from this computer. So, but I could understand, because for the health regulators, they are not trained to do the investigation or to do the digital evidence collection. So that's why I have mentioned a lot of time that they have to work with the police, let them to do their work. And also, we have to provide the training to the officer if we need to take this technology. And I just came to my mind that why they don't adapt this technology on the products. I guess perhaps if we take this kind of, or if the pharmaceutical company, maybe this is the answer that I have to provide by Barbara. If the pharmaceutical company decide to put the technology applied to their products, it may increase the price of the product, right? So I don't know if it is also affordable to the countries or by the people that they need.
Yeah, maybe I can comment on that. I think, at the end of the day, we're really talking of devastating effect on the patients and also really impact on the reputation of a company. It's not about serialization code that will change the profit of a company, and it's not about really technology deployed in a country. I mean, we were talking about the RAM spectrometry. That's exactly what we are also trying to implement and continuously implementing. It's of course a risk-based approach. Can we cover every country, every single corner of the world, probably not, but we have a risk-based approach toward that. And as we discussed, it's really, again, important to make sure that we work together, public and private sector together, to really bring whatever evidence that we find on the way up to the court and really identify bad actors, and not just one pack of medicine here and there, because that will not fix the problem, right? It's the source that we need to address. So that's for sure one element that where we need to do even more in this journey.
Yeah, and I think, in light of, we've just heard the complexity over and over, but in thinking about the pharmaceutical supply chain, illicit, legal, public, private, and the diverse priorities of each different stakeholder, I'm going to list them out because it's overwhelming. Pharmaceutical companies, regulators, compliance bodies, logistics and transportation service providers, distributors, wholesalers, retailers, healthcare providers, and consumers. What has been driving me nuts at this conference, I don't want collective action to be a buzzword, you guys. What is the recommendation for how to operationalize from your role in this crazy, value chain? How can we work together to curtail the illicit trade and bring, those corrupt actors that are involved, bring them to justice? Who wants to start? Easy question.
Well, let me start from NEC. Okay, well, this discussion was quite interesting, and I just want to add one thing. We see from the stories of these panelists, we see so many efforts already made individually. So what I see would be, we need to bridge the gap, or we need to bridge each stakeholders into one. So one of the ideas, that's why I came up to the idea to provide blockchain technology that can be one single platform to everyone. So one point I want to add is, well, blockchain technology doesn't need to be made from scratch. So we can utilize the existing systems which was already made by the efforts of each individual sectors. So we just connect the data transaction into the one single platform so that everyone can see what is happening for the easy and quick information access. So that's how we connect all stakeholders, either it's public or private, or the legal enforcement entities or the aid entities. We can put into the one single platform to work together.
Yeah, it's a great point. Some of the regulators have directorates of enforcement that sit under them, because it's a big question, though, when you look at the transnational pieces, where would the blockchain technology sit? So the governance and data sharing is key. And I know we've talked a little bit about, your thoughts on NCB to NCB, the National Control Board systems. To what extent could there ever be a data sharing parameter that would get at this governance question?
Yeah, so for me, I don't like this kind of a discussion on the data sharing, because for me personally, I think we have to work together and share our knowledge. But unfortunately, in reality, there are lots of different rules, different mechanisms to safeguard the data sharing. And especially when we are working with a private sector, sometimes the sharing of information or exchange of information is not two-way street. You could understand that, for example, for the private sector, they can share information with us. Let us do the investigation. But at the end, maybe we cannot share the results to them. Of course, we can share the open source information with them, but we cannot tell them a lot of investigation. So, this kind of collaboration sometimes hinder our long-term collaboration. And also for the platform, I think it's good that we can share the knowledge, share the trends. But sometimes when you work with external organizations, without an agreement, a corporate agreement, it makes us difficult to talk to each other or use the information in court to prosecute the offenders that we have. So I think this is quite important to work with your data policy officer and to find out what is the best way to share the information.
Okay, thanks. Tom, I wanted to come back to you. I mean, on role of technology, I mean, but you've worked a lot with the national authorities, and they require highly specialized training. We've seen some of them that know how to conduct investigations aren't aware of pharmaceutical crime. Some of them that are aware of how to prosecute corruption also aren't aware of how to detect pharmaceutical crime. What else do you think is an essential element when it comes to the impact and the fight against falsified and stolen?
Yeah, thanks. It's been hinted around a little bit, but at some level, you just need national ownership. I mean, you need national authorities to take the issue seriously, to be educated about it, and to have basically an all-of-government approach. It doesn't just reside in a drug enforcement agency or a Food and Drug Administration. The police do need to be involved. They need to learn to work together and speak somewhat the same language. It also requires political will, because when we link this issue of illicit medicines to corruption per se, not just criminality, but actual corruption. Corruption connotes to me like government involvement. You need to get to the bottom of, in a particular country, how high does it go, this corruption, and will the leadership turn the page and say, we can't tolerate it anymore? And will they do the right things to empower their own national agencies to go after this? So again, it's not a question of lack of technology. We have technology. I can deploy trainers tomorrow to any country and have them come alongside national agencies and teach them how to, do proper investigations, teach them how to organize an enforcement activity, whether it's with Interpol or anybody else. But at some point, you need that top-down leadership. You need a signal from the very tippy top that you will be allowed to do your job. Because the thing that I always find is that many of these national agencies, they want to do their job. They don't have the tools, maybe they don't have the car, maybe they don't have the desk, let alone a Raman spectrometer, but they want to do their job. It boils down to whether somebody will let them do their job. So I think collectively, we need to think about getting that top-down support, the leadership, the political will to actually act on this thing. And again, I'm going to reiterate, this is not like other forms of corruption. There are victims here, thousands, if not millions, okay? And it's coming to a medicine cabinet near you. Here in the US, we have the fentanyl crisis. Those are counterfeit medicines. They're laced with deadly fentanyl. They've killed 100,000 Americans plus this year. So we're not immune to it in the US. In Africa, it has a different look. You have to address it differently. But again, I think it starts with national authorities getting the right signal from their political leadership.
Thanks so much. Can you comment a little bit, though, on the recent example of collective action that we took in sub-Saharan Africa to convene, prosecutors, judges, border personnel, regulators, to have this kind of conversation around best practice and the challenges on detection? I mean, I think it's a prime example of what collective action can look like in terms, to your point, on sharing knowledge in the space.
Yeah, so recently we gathered in Zambia 5 countries. They're regulators, chiefly. They were mostly regulators. And with the idea that they just need to get to know each other. So in a lot of ways, we were able to say, look, do you realize that there's flow of stolen medicines coming from your country, landing in your country? Oh, yeah, we maybe heard about that. And I said, look, at the end of the day, it's not so much about giving you more technology or ways to address this. It's so that you know who to pick up the phone and call when you say, okay, we've got a problem between Zambia and the Democratic Republic of Congo. What can we do together? By the end of 2 days, they were already, saying, let's set up a WhatsApp and we're going to work on this and do some cross-border enforcement activity. So it boils down to sometimes just the simplest of things. People knowing people knowing who they can call to partner together. And I think when you talk about collective action, we don't always need more technology or bells and whistles. We need people getting together to solve a problem.
Thank you so much. So I think we're at the point where we'd like to open it up to the audience, but I wanted to see if there are any other final remarks from our panelists first.
Maybe I can give it a start. I think it was really teasing a lot of thoughts. I think we really touched base on a number of different topics in this panel, and it was really great to see the different aspects of technology, the overall private sector, the political elements, and regulatory aspects and enforcement. So it's really great, and I think the other element of this is let's talk about it, right? Because again, it's a topic that is important. It's a topic that have really effect on patients, on reputation, on society in general. So that's an important topic. So it's great having this topic here at this conference, and I hope this will be just a teaser for the future and continue talking about the topic as well and bringing together in a panel private and public sector together to work on the topic.
Thank you. Anyone else?
I know many of you, I'm like maybe the last thing between you and a Friday night after a 4-day conference. So I'll get my final comment over with real quick. We hear about data. It gets quoted, the 1 in 10 medicines may be falsified. Well, in the U.S. government, they've said, oh, maybe it's 1%. Well, in the U.S., we fulfill 4 billion scripts every year. So what's 1% of 4 billion? It's a lot of fake medicines in the U.S. The bottom line is in many countries, we don't know. The data picture is so cloudy. If you look, you will find, I think we need to have the courage to look because lots of lives are at stake. This data question. Everything that we do is big data, and it's got to be driven by data, and it's got to be targeted and focused. Well, we're not looking in the right places when it comes to this illicit medicine problem. I guarantee you, if you go into any African country today, tomorrow, you will find fake medicines. How to quantify that? Another issue. How to quantify who's stealing? Another issue. But we can't be afraid to look. That would be my parting advice is let's not be afraid to look, and let's all pick up the piece of it that we each have and work together to solve the problem.
Thank you so much. Anything else? Okay, so we're going to open it up to the audience. I think there's a mic if someone has a question. I see one here and one in the back.
Hi, Jennifer Lewis from USAID. Thanks so much for this. It's really an amazing array of inputs on a really complex topic. Thinking about it from the donor perspective, I'll just say we have obviously been thinking about this issue of trans-sectoral corruption quite deeply and the way that it impacts these complex supply chains. And I think the complexity of the supply chain only drives the question that I have perhaps more acutely in this space, which is that of all the many things we could do to try to tackle this problem, where do you think the biggest entry point would be? Is it on the data? Is it on the investigations? Is it on the private sector engagement piece? Is it on community awareness? Like there's so many different points of entry where if you could make an edict would be the highest yield, highest impact for people investment that donors like us might make. Thanks.
Who wants to go first?
I think this is a very good question. And, we talk about law enforcement, technology, and also sharing of information. But I think we also miss one element is about the publicity. I mean to raise awareness of the people and the government. I would take Operation Pangaea as an example. Why we need this operation? Yes, we need to ask the law enforcement or different agencies to work together to fight crime, to let them know they have to do something which we call it murder or corruption. But more importantly is they have to let the public and also their boss to know that, hey, come on, we have to pay attention on this crime area. And, I mentioned that we don't have a superhero. We don't have a hammer, we don't have a shield, but we have a good Gillette with an Interpol word behind. So I think this is a very good proving that if we can work with our member country, and if there is a successful case, maybe you have a US police or you have other agency, we can wear the same uniform, which can do a very good publicity, have a good effect on the public. And also, if we have this kind of successful case, we can also share the case with the manager of the unit so that they are aware that, hey, this is the problem, not just a national problem, it is also is a case or a problem that Interpol or other international organizations would like to intervene or to want to solve the problem.
Yeah, you raise a fantastic point. It's another area that USAID's investing in is public awareness campaigns in countries that have both public and private sectors distributing medicines. There's not a general awareness of which ones are available for free and what are my rights around that. And so we have civil society organizations that are engaging in those public awareness campaigns, ensuring that there's a feedback loop to the regulator that should be able to take an action whenever they notice that something that should be made available for free, they're being asked to pay and make an informal payment. Did anyone else want to comment on the entry point? From
Yeah, maybe another aspect where I would really love to see major step is really on the policy and regulatory aspects, because there are a number of countries that are quite advanced on that, a number of countries that fall behind. That's not the really priority focus area. So that's an area where I think, again, together we can work on that and really raise the bar and ensuring that also from a policy perspective and regulatory framework, we advance that, because that's really not state of the art yet, I think.
You asked a somewhat donor organization-specific question, and your issue is a little bit different in that you have U.S. taxpayer-funded or Western taxpayer-funded medicines going into these countries and being stolen. So what's the point of intervention? First of all, I like to say that you need to know what you don't know. You can't bury your head in the sand. You need to know the scope and scale of your problem. So you need to have third-party assurance, basically telling you, okay, how many of our medicines are being stolen, where are they going, and at what scale? So you need the lights on, essentially. So call it data. You're collecting information. That's the first thing. But again, I say that it needs to be a national solution. So USAID or the Global Fund or none of the big aid organizations, UN, they can't go in and solve this themselves. So they're going to need to partner with national agencies, national authorities. Interpol has to do that, so will the aid organizations. You are going to find, though, that in many cases, they don't have the ability to do the job. So it becomes an issue of some capacity building, but I hearken back to the whole political will sort of issue. The aid organizations need to elevate this concern. Illicit medicines kill people. Illicit medicines also drain a non-bottomless resource. Western taxpayers aren't going to keep throwing money away and buying, houses on the Riviera for people. They're just not going to do it. These are the types of things that make people cynical about aid. So it's a shame to waste these limited resources. So keep the lights on, know what you don't know now, and don't be afraid to look. And two, build national capacity that can ultimately, sustainably help you address the problem.
You want to comment? No? Okay. Well, I think we had one more question in the back. Oh, and in the front.
Yeah, thank you. Aivar Sepp from the Estonian National Criminal Police Corruption Crime Bureau. Thank you for a very interesting presentation. The topic is definitely very serious matter. And my question is, do you have any specific patterns? What are the most common falsified medicines? Or is it like what type of medicine is the subject of this crime? Thank you.
I think that's for you.
Yeah, so I could share with you that in our Operation Pangaea in the past more than 10 10 different year, each edition. Usually, for erectile dysfunction is the number one of a category of seizure that we receive reporting from our member countries. So, but it depends, and sometimes for the second and third, it depends on which year you conduct the operation. For example, during the COVID time, maybe you can imagine the trends or the need from the public is different. But in the last 10 years, I can say the number one, the top category is always the erectile dysfunction. But in the recent trend, if I still have time, I would say that we also observe the weight loss pens, maybe also have the like Ozempic, maybe also will take a similar situation like erectile dysfunction. Because for Ozempic pens, usually the patients, because for the Ozempic pen is for the weight loss, but this is a off-label use. So most of the patients, they cannot go to the legitimate or the legal practitioner and ask for the prescription for this product for their weight loss, which means that they have to do it secretly, or they have to do it on the internet so that they can get the product. And maybe for the same reason, for the criminals, they think because it doesn't need a prescription to sell this to the member of the public, so they can supply it on the internet, on e-commerce platform, and then just ship to the doorstep of the consumer that they ask for. So we can see that maybe in the future or the next few years, weight loss pens maybe have the same. We will have a growing trend for these kind of products.
And it's a huge challenge now for the drug regulatory authorities that are trying to ensure validation and registration of legal pharmacies. So how to deal with e-commerce, Facebook Marketplace. We're seeing it picked up from everywhere, yeah.
Your answer to this question about what's most faked, it depends on where you sit, which country you're in. So many Africans don't care about Ozempic and weight loss pens. They're worried about anti-malaria medicines, tuberculosis medicines, anti-malarials. The bad guys, they're faking everything. I mean, they're doing falsified everything. So it doesn't matter whether it's high-end cancer drugs in a Western country or if it's an anti-malarial medicine in an African country. So I think the problem looks different depending on where you sit.
Thanks, Tom. I think we have another question here at the front.
Sorry. Thank you very much. Fantastic panel. My name is Olajobi Makiwa. I'm a Nigerian, but based in the United States. Coming from Africa and indeed Nigeria, why do people like all this type of illicit drugs? Because they're very cheap and people are poor. So that's all they can afford. My question, therefore, I'm actually torn between so many things. We've heard already here that most of the regulators in these countries do not have the capacity to address these challenges because they have myriad of problems to deal with. And I agree, the issue of publicity is very important. Very, very important, because even on our continent, Africa, when you mention death to people will sit back. So it's important, mine is that it's important for your group to actually be open and say it the way it is, for people to understand that indeed this will lead to your death. If you do that, people will actually listen. But unless you connect it to that, or we're trying to be nice and all that, it's going to be a big challenge. Now, I want to ask you, you had a session with regulators in Southern Africa, I think Zambia or so, and they were very eager to set a WhatsApp group, right? How do you follow up? Given the fact that these people, they get back to their countries, they have other things to this might not be on their priority list. But if you follow up with them in terms of where are you now, I believe action will be taken, So I want to ask you, are you following up? Is there a process? They're not babies, but I can tell you that poverty, this is a big challenge on my continent, and people have other issues that they're dealing with than to start talking about this when they are not even told that this is death, a death sentence for you. Thank you.
Thank you so much for your comments. I would also just share, and it was unfortunate, WHO was also going to be on our panel, but a positive case of collective action working in the context of Nigeria was where through third-party monitoring of donated medicines, we were able to identify Falsified and confirmed with the manufacturer, who then shared that information with WHO, who advocated to NAFDAC, who released a rapid alert to the public saying exactly what you said. Do not buy this. Take it off your shelf. Do not spend an entire month's wage on an anti-malarial for your child who will lose their life, right? And then to your point on follow-up, and I'll let you, Tom, you can speak to maybe some of the specifics. But in this context, we are following up. There's continued technical assistance to regulators and to understand what their key takeaways were from the regional convening.
I think it's a great question because in my experience, I think the under-resourcing of some of these agencies means that when you go away, if you're a trainer or you're an aid organization and you do something for a few days and you go away, these people go back to their everyday job and it's a grind. They don't have the resources, they're pulled to other things. So I think if you want sustainable engagement, you better darn well go back regularly, stay in touch regularly, build their capacity, more training, give them more equipment. It can start basic, but to me, it's one of these things that needs to be on a regular basis. There are no one-offs. There's no one-a-year operation. It needs to be, you're training people to think, every day I'm going out and looking for these deadly medicines. How do I do that better? If you want them to act, just think about your own human relationships. If you don't talk to somebody for a year, they're going to forget your name, let alone how to do a job, a complex job. So I think sustainability means that aid organizations, countries that have more capacity share with countries with less. But another very interesting thing that I've seen recently is a lot of kind of mentorship south-south. Nigeria is a great example. NAFDAC, the regulatory agency there, they have hosted no fewer than 5 or 6 different countries from around Africa, giving them their example of how did you start traceability? Oh, it was during COVID, and we had to hand label all the vaccines and trace them through our own supply chain. Let us show you how we did that. That's almost more powerful than parachuting people like me into Africa for a few days. So I want to think about how we can do more of that, helping countries learn from each other so that they can kind of shorten that runway to learn some of the basics. Whether it's Estonia working with Latvia or, whatever the case may be, learn from each other.
If I may, I would like to comment on the price or the affordability of the medicine in Africa. I would use an example that now we are thirsty. We have water. Will you drink it? Of course you will drink it, right? But if you know this is salt water, will you drink it? Some will not, because I always said that common sense is not common sometimes. For example, for the salt water, if you grow up in inland country, maybe you don't know there's water you cannot drink. I think it seems like a medicine because I know for some people they cannot afford the expensive medicine. They will listen to their friends, word of mouth, and to take medicine that they think can help them. But at the end of the day, it's not safe. And if they know that it's not safe, or even if you take the pills, it will make you even worse, perhaps they will not take it. But we have to do this kind of publicity. We have to let them know to keep our so-called common sense to be very common. We have the same level of this kind of knowledge, and then I believe the criminals, the demand of illicit medicine will decrease a lot.
Are there any other questions? One more. Thank you so much.
Yeah, thank you for this discussion. My name is Vladislav Nityaev from Transparency International Russia in Exile. So right now our team are looking at not transparent import schemes contributing to corruption in Russian medtech market. And we're seeing schemes of import of overpriced medical devices through official distributors and resellers to Russia. And my question is, how widespread is money laundering through the supply of falsified medicines to high corrupt countries like Russia? And what's maybe a level of participation of official distributors or maybe resellers if it happens?
So Interpol, we are a neutral organization that we don't take stand in a lot of areas, including culture, religion, military, politics. So I would say, even we have the crisis in Ukraine, we also, Russia, or other countries, they're still our member countries. So as long as there is a need for us to support their investigation, to fight crime, our role is to support our member countries to work together. So believe me or not, for police, they want to, our enemy is always the criminals, the organized crime groups. So we don't talk about, most of the time, or in our regulations, we are prohibited to talk about politics.
But I think he touches on a point that maybe you can say something about, because we've talked about some of the passing the buck that can happen with investigative bodies. Like you're a specialist of pharmaceutical crime, and I understand there's an anti-corruption division. Is there also an AML division? Would the three need to come together to really crack a transnational case in this space? Maybe you could say a little bit about the money laundering.
Yeah, thank you for rephrasing the question. And just like what I mentioned at the very beginning, I have little knowledge on anti-corruption. But for the money laundering, I think this is an area that pharmaceutical crime have to work together with those AML units. Because why people or why criminals do pharmaceutical crime? Make money, quick money. And if I'm criminal, I would go after this area. For drugs, you have very serious offense. You have a big consequence if you get caught. But what is pharmaceutical crime? Of course, in certain countries, you have maybe have a good legal system or have a series of consequence imposed on those offenses. But in most of the countries, unfortunately, the offense may be just paying a few money. And then, so that's why for us, we work together with our financial investigation team because we want to trace the money flow. Just like Operation Pangaea, we are not just want to find out or intercept the illicit medicine at the entry or exit point. We want to find out who is the ringleaders, where is the money go to, and then to seize the financial or the crime proceeds of the criminals.
Okay. Thank you so much, and thank you to such an engaged audience. So just to close and to wrap up, I think we've heard about prevention, mitigation, and detection, and the need to have multi-pronged and multi-sectoral approaches across that entire phase. And also that leapfrog technologies, while they may advance detection or kickstart law enforcement at a different step in their investigation, this hard work of convening and aligning stakeholders around collective action is paramount. And I wanted to say, at USAID, we're also bringing new resources to address this complex problem. We actually have a Countering Transnational Corruption Grand Challenge, where we're engaging a diverse range of stakeholders to design a multi-million-dollar prize competition that looks to address falsified and diverted medicines within health supply chains. And we're looking for like-minded partners to bring your thought leadership and financial and in-kind resources. So if you can imagine a way you'd like to engage in this challenge, given where you're sitting, we're looking to maximize collective impact to tackle the critical issue that we've discussed today. And we know IACC participants have unique perspectives, so please, there's a little flyer here with a QR code, and we'd love to remain in touch if you have ideas on how to further this dialogue and our collective action in this space. While the complexity of this nature of transnational corruption cannot be diminished, we hope throughout the session you're able to identify entry points for collective action within your respective area of work, because we note it will take all of us. Thank you so much.
Thank you.